We're going to begin the tension headache treatment by focusing on the rectus capitis posterior major. This can often develop trigger points, which can refer pain into the head, mimicking the patterns of a tension headache. So you're going to start with the client face down, and then you're going to place your thumb just underneath the suboccipitals, and the direction of your pressure is going to be up towards the spine and towards the head. You're trying to sink in down underneath the splenius, the trapezius, and you're just trying to find that little muscle. Alternatively, you can use a reinforced fingertip. The rectus capitis posterior major connects to the dura mater, which is the protective covering of the brain and spinal cord through a fascial structure called the myodural bridge. Dysfunction in this muscle, such as tightness or trigger points, can irritate the dura mater, contributing to headaches. Now, I don't know if you guys have ever had a tension headache, but a lot of times the lights and sounds can be irritating. So to block that out by placing a hot towel over the client's face, over their eyes and ears, leave the nose and mouth open for them to breathe, is going to be really nice to bring them into a kind of nurturing space to calm the nervous system and just a moment of relief. The upper trapezius is a muscle that can refer pain into the side of the neck, behind the ear, and up to the temporal region of the head. You're going to locate the muscle, and then you're going to palpate along it to find any trigger or tender points, and then you're going to shorten the muscle by rotating their head towards your fingertips. Hold this for 90 seconds. You can do some nice circular motions to relax the muscle as you're working through it, and we're really focusing on decreasing tension in this muscle, which can really be affected by forward head posture and stress. Now slide your fingertips up either side of the cervical spine and do some nice circular motions in the posterior neck. Drag your fingertips all the way under the occipital ridge in the base of the skull, and then place the head in a slight extension as you drag your fingertips slightly back towards you with a nice soft touch. You're going to hold this for 90 seconds or until tender or trigger points or the muscle belly itself releases. The suboccipital muscles surround the greater occipital nerve and other sensory nerves at the base of the skull. So tightness or trigger points in these muscles can irritate or compress the nerves, contributing to headache pain. Once you've held that, you can slowly release it. You can do some more work in the suboccipitals by getting the client to bring their chin towards their chest as you drag through and gently elongate those tiny muscles in the base of the skull. And then we're going to move on to working on the face and the jaw. Trigger points in the temporalis, the masseter, the occipitofrontalis can refer pain into the head, mimicking or worsening tension headaches. I like to work around the jawline, just spreading down, stretching that muscle. A really nice technique is to get the client to slowly open their mouth and jaw as you use your fingertip pads on both sides to elongate that masseter muscle, which is usually held so tight in people who have stress or forward head posture. You can work around the sinuses, moving from the midline outward. And then just do some nice techniques in through the jawline. Nice circulatory techniques, not too much pressure. You're still focusing on relaxing the client and bringing the nervous system down. Work in through the top of the head, around the ears, pitchfork your hands, and just do some nice motions up and down, stretching out the tissue around the front of the face in the frontalis muscle, spreading from the midline outward. And then work into the temporalis, just going up and down gently, just bringing some circulation to the area, stretching out the muscle around that temporalis. And a really nice technique, kind of the relaxation pièce de résistance part of the treatment, is to do some pincement to the eyebrows, which sounds pretentious, but trust me when I say that this feels really nice. So you're just pinching along the entirety of the eyebrows. I've been toying with this new combination acupressure point technique, which I find clients are really enjoying, and my thought process is, why not kill two birds with one stone? So I'm going to press down with 2 fingertips on the inner eyebrows on bladder meridian 2, and then my other fingertips going to be on yin tang in the third eye. I'm going to gently push down and then a little bit up, which is really nice for relieving eye tension. And I'm going to hold it for 30 to 60 seconds and then slowly release my fingertips. I like to finish the treatment by doing some effleurage around the face, the scalp. I'll work in through the pecs, the anterior deltoid, the upper trapezius, so we're just closing out everything that we've already worked on. Now, my focus with a tension headache treatment is to down-regulate the nervous system. So I'm trying to shift the nervous system from a sympathetic fight or flight mode into a parasympathetic rest and digest. So I like to do a lot of flowy techniques. I like to do some holds. So I'm bringing the client into this really sleepy state. And if they fall asleep, then mission accomplished. I don't like to do a lot of jostling of the body. So I'm not moving the shoulder around. I'm not moving the joints around too much. I'm really trying to bring them into a place of stillness. Once you finish doing all of your effleurage techniques, I like to finish the treatment by placing my hands over their ears. I'll hold there for about 10 seconds, drowning out any sound around them, and then I'll slowly release my hands.